Ankle fractures case discussion. A 45-year-old male presents with a left ankle injury sustained 12 weeks ago after falling downstairs. Due to delayed medical care, the injury has progressed, and imaging reveals a chronic Maisonneuve injury with proximal fibula fractured callus formation and significant fibular shortening. The injury involves disruption of the ankle syndesmosis, which requires surgical intervention to restore stability. Diagnosis: chronic Maisonneuve injury characterized by proximal fibular fracture with shortened fibula, syndesmosis disruption leading to ankle instability. Management decision: the next best step is fibular osteotomy and syndesmosis open reduction internal fixation. Fibular osteotomy, lengthening of the shortened fibula to restore normal anatomy. Syndesmosis open reduction internal fixation stabilizes the disrupted syndesmosis and restores ankle alignment and function. Possible Viva questions and answers. What is a Maisonneuve fracture? It is a type of ankle injury involving a proximal fibula fracture associated with an ankle syndesmosis injury and often a medial malleolus fracture or deltoid ligament rupture. Why is fibular length restoration important in this case? Fibular shortening can lead to ankle instability and malalignment. Length restoration is crucial to ensure proper syndesmosis reduction and ankle function. What are the components of the syndesmosis? The syndesmosis consists of anterior inferior tibiofibular ligament, posterior inferior tibiofibular ligament, interosseous ligament, interosseous membrane. Why is closed reduction not sufficient for chronic syndesmosis injuries? Chronic injuries have developed fibrous tissue and callus formation, making closed reduction inadequate. Surgical intervention like osteotomy and open reduction internal fixation is required to restore anatomy. What complications can arise if this injury is not properly managed? Complications include chronic ankle instability, post-traumatic arthritis, pain and functional impairment. How is fibular osteotomy performed? A fibular osteotomy involves surgically cutting the fibula, lengthening it, and stabilizing it with plates and screws to restore its normal length. What imaging findings are suggestive of a chronic Maisonneuve injury? Findings include callus formation around the proximal fibula fracture, widening of the tibiofibular clear space or syndesmosis widening, fibular shortening. Why is external fixation not appropriate in this scenario? External fixation is typically used for acute fractures or temporary stabilization. In chronic cases, anatomical restoration requires osteotomy and internal fixation.